Respirologist and associate professor in the Department of Medicine at the University of Toronto. Good morning, Dr. Gupta.
Morning, Heather.
Okay, I don't know if this is going on in your life, but this is going on in mine. So this is why I want to start there. Thanksgiving weekend behind us, and hopefully we had lots of time to gather with friends and family. But I know so many people who are talking about scratchy throats and losing their voice and sniffles and everything. And people are wondering what to watch for. Is it COVID? Is it a cold? Can you just begin with symptoms that should be of concern, particularly for this Omicron variant? What are the most common symptoms we should watch for right now?
Yeah, it's becoming really hard, Heather, because as you say, there's flu around, there's RSV, there are other viruses, but of course there's COVID. Unfortunately, it looks like as we've gone on with different variants, and particularly with Omicron, we've lost some of those specific symptoms. Not that they can't happen, but at least from some of the data we've seen, it looks like that loss of sense of smell and loss of sense of taste, which were the things that should really make you think COVID previously compared to other viruses. Those seem to be less common with Omicron, and many people are reporting just a sore throat. So that becomes really hard to distinguish. So what you really need to do is test. Unfortunately, the tests are probably also not as good, the rapid tests with Omicron compared to prior variants. But one thing you should do is definitely swab the inside of your mouth and the back of your throat before you swab your nose, so that you increase your chances of getting that, finding that Omicron if you have it.
Excellent. You remember when we did the first swab, you and I, we were doing it live for the first time to show people how to do it. That's what I'm doing now, both sides of my cheek, back all the way sort of to the uvula, and then my nose. So that's exactly what we should be doing now. Is that right?
That's right. That'll improve your chances. Still not a perfect test, but
right.
If you do that repeatedly a few times, there's a good chance you'll find it. It's there.
Okay, and watch for sore throat. That seems to be something that's coming up commonly.